Hello, everyone, and welcome to today's webinar. I'm Steve Myers, Managing Editor here at Digital Health Insights. And in partnership with AGFA Healthcare, we're happy to bring to you today's webinar, Reduce IT Burden with Innovative Imaging Technologies, the Role of Streaming and Cloud Technologies. Before we get started, just a few notes. We'll have a presentation followed by some Q&A. At any time, feel free to submit any question. You'll see a Q&A module. You can click on that, submit your question, and we will answer as many questions as we can before the end of the webinar. Also, the webinar will be available on demand after this presentation today. You will receive an email kind of notifying you of the link to climb back in and see the webinar again as you like to on your own time. So look for that on-demand email after today's event. I'd like to introduce today's speaker to you is Kyle Cellini, Director of Enterprise Imaging Radiology for AGFA Healthcare, where he leads product direction and consults with healthcare systems and radiology practices across North America. Over the past 20 years, he's worked with some of the leading healthcare systems and technology companies, primarily in the medical imaging space. So now let's turn things over to Kyle to get us into the presentation.
Hi, I'm Kyle Cellini, Director of Enterprise Imaging Radiology Solutions here at AGFA Healthcare. Really excited to be with you today to talk about some of the roles that streaming and cloud technologies are allowing for IT organizations to reduce some of the traditional burdens that you may be experiencing, and especially with the topic of radiology shortage, physician shortage, and how that's expanding some of the concerns for medical imaging. So just our agenda today, I'm going to cover some of the market trends around physician shortages and how the physician shortages is pushing the teleradiology market growth, and then go into those pixel streaming and cloud technologies and how you can leverage them to reduce some of the traditional burdens that IT may be experiencing around storage and movement of data. And lastly, we'll just cover some of the real-world examples of how organizations are having to meet business goals around physician agreements, radiology group contracts, and how this is creating new burdens and how these technologies can help alleviate those as well. We'll finish with a little bit of live Q&A and hopefully answer any questions that you might have. So let's talk a little bit just briefly about the physician shortages, teleradiology market. Now, it's not any surprise that imaging volumes have significantly increased over the last decade or two. Just from 1993 to 2021, we've seen about a 4x growth in the number of MRI and CT scans per capita. So when you multiply that by the sheer size of data, this is a exponential growth of the amount of storage that's being required for medical imaging. And the physician shortage population or physician shortage is just exponentially growing the concern of how you're going to have to create new leverages of being able to distribute those data sets to the appropriate readers. So we just want to kind of go a little bit over some of the volume growth here. And this is some data from an American College of Radiology study that looked at the number of exams and the work RVU units that go along with those exams in level 1 and level 3 trauma centers. So from 2014 and 2021, there was about a 35% increase in the amount of relative value units or work that is associated with the number of radiology exams being ordered at level 1 trauma centers. And while that's a significant increase, the increase is even larger at level 3 trauma centers. So at level 3 trauma centers, we're seeing a over 75% increase in the amount of work related to the number of radiology exams being performed. And when you dig a little bit deeper into the numbers, it's interesting because MRI scans have increased over 50% at level 1 trauma centers, while only 2% at level 3 trauma centers. Inversely, at level 1 trauma centers, CT volume's up 35%, while at level 3 trauma centers, CT is up over almost 75% again. And this kind of goes into working, the topic that it's not just about the volumes, but about the volumes at your facilities, and really working with your medical leadership to figure out what specialties, what type of imaging and relationships that you're going to have to expand on to support the type of growth that you're experiencing, but also seeing what's coming down the pipeline. Because if you're a more rural center and the tradition, the care models are changing, meaning MRI scans for blunt trauma for C-spines is increasing at level 1 trauma centers due to research that may be a trend that you start to see in your community health centers as well as you move forward. So it's really important to work with your clinical leadership to figure out how these trends and how changes in care plans are going to adjust the volume of types of studies that you're going to experience. With the physician shortage, this leads to an expansion in the teleradiology market. And this, you probably read many articles about this and how VCs and private equity firms are, pushing a significant amount of funding into these organizations to grow the size of those service organizations. Now, it's great because now we've seen these organizations grow, and we've actually spoken to some of our key luminaries across different radiology spectrums and subspecialties, where these physicians that are nearing retirement due to this increased demand are seeing increased salaries through these teleradiology services, and they can now go into semi-retirement and provide their key luminary experience, high quality interpretations through teleradiology services to the community centers that may never have been able to access that level of quality of interpretation before. However, this increase in costs and salaries is just pushed down, obviously, to the health systems that you're working through. And so as you're starting to look through the increase in costs for the interpretation and physician services due to the decrease in shortages of physicians, we're having to leverage technology in a more cost-effective manner to not only manage the volume that we have, but manage the volume that's coming and manage the diverse relationships that you're going to have to maybe expand on, where traditionally you may have one or two radiology group practices reading for you. As volumes grow and those group practices may not be able to manage the additional growth that you're throwing their way, you may have to expand your reach and work with even more group practices. Now, traditional issues with all of this also comes in just the challenges of medical imaging and DICOM data itself, right? Like DICOM data is large data sets. These data sets can, in an average study, 50 megabits up to 2 gigabit. And the images themselves, especially more modern scanners, have high pixel density. So the movement and representation of these images has to be of the highest quality. The other issue is that the studies themselves are not just large, but oftentimes you're being required to send the active study as well as multiple other studies for prior comparison or comparison to prior exams. And for some exams, this may just be one prior that they're comparing to, but for certain care or certain specialties, these physicians require 3, 4, or 5 priors, especially in the realm of mammography where the pixel density is very high, and you may want serial follow-up for comparison to 3 or 4 exams for lesion management. And lastly, just DICOM itself is latency sensitive. There's lots of acknowledgements or acts that have to be, performed during the transfer of this data, which makes movement of data very latency sensitive. And when you're dealing with multiple remote readers now, you're not in control of their home networks often. And this is also a concern when you're trying to push large data sets to locations where there may be a large geographic expanse, increasing in high latency, or there may not have the highest bandwidth at home. you have experience with physicians having to either A, pull down studies and go do something else while they wait for those studies to load, or you're trying to work through remote sessions through Citrix or other type of services where this is typically not a great solution for these types of high pixel density images or high frame rate rendering. So let's talk through a little bit of the newer technologies and how these can help alleviate some of those issues. The first is pixel streaming. And so pixel streaming essentially is that we are painting or rendering the pixels only, which have been rendered at a server-side location, and at the remote viewer, only the pixels on the screen at that given time are being moved and displayed. You're not having to pull down the entire data set or wait for the first image to load, because as soon as the first pixels on the screen load, you're instantly reviewing the case. And as you cycle through the images, the pixels re-render. And this allows for definitely ability to work faster no matter what situation that physician is working under. For us, we talk with organizations all the time where our streaming technology can support 10 megabit per second bandwidth with higher latencies in the 60 millisecond realm. Now, you would want to work with your individual vendor because every vendor is doing this slightly differently, and their, your miles may vary with their capabilities on bandwidth and latency. The other thing with newer modern streaming pixel technology is that this is not just your universal viewer anymore that you're probably accustomed to with VNAs or universal archives. Streaming pixel technology, modern streaming pixel technology, is not a portal viewer. It's a full diagnostic capability supporting multiple monitors and integration into your EHR, which is extremely important for referral patient population. And as we move to a more patient experience focused health system, we want to make sure that those viewers can be a single place of location for navigation of care journeys with patients. And the last thing from your IT organization, you want to make sure that you're not being bogged down with management of these streaming applications. Modern applications work in the browser so that you can get remote readers up and quickly no matter where they're at. A browser requires no download, no management of updating that client in the future, so that you've really reduced to a minimum what IT support is needed. But obviously it's taken a while to get here, and I just want to kind of cover some of the types of PACS rendering technology. So as you're talking to vendors, you kind of think through where you're at or where they're at and how you get to the most modern technology. So a traditional generation 1 through 3, types PACS rendering occurred where the PACS was essentially a server or archive and moved all of the imaging down to a local workstation to actually perform the rendering. So you had dedicated workstations, typically graphic processing unit, GPU rendering technology at the local workstation. And as we've progressed, there's been newer formats for being able to transform the DICOM data into JPEG and PNG, and you see this a lot in web client technology, universal viewer technology as well. But with pixel streaming, we've really moved towards rendering those images at the server side and then only streaming the pixels. Now, early generational pixel streaming, we would consider like a Gen 4 PACS rendering technology, still required high graphics processing unit requirements. So GPU cards, which are expensive and sometimes difficult to acquire effectively and maintain. My son just was looking at GPUs for his gaming system, and they're probably as much now as cars were for a starter vehicle when I was first starting to drive. So they are definitely not cheap. The other thing with these Generation 4 is traditionally you'd see these as installed clients still that still had to be maintained by your IT system in some form or fashion. The Generation 5, the newest pixel streaming technology, really moves that PACS rendering to a CPU-based rendering, reducing your costs at a GPU level, and also does not require any implementation or client maintenance. Everything is done at a web browser level. So it's one less thing for your IT system to manage. So it's hard to talk about streaming without talking about cloud. Cloud is definitely a movement for most organizations. And when we talk about pixel streaming, most assume pixel streaming occurs in the cloud. And that is true for most of our clients. However, it's not a mandate. So pixel streaming and the technology that we do use, at least, is often implemented at an on-prem implementation as well as in a cloud. But there's definitely significant benefits to moving to the cloud. First and foremost, accessing the ability to collaborate across geographic locations can be easily supported through some more very secure remote access when we start to leverage cloud vendors that, their lifeblood is the cloud. The ability to secure and maintain cybersecurity threats can be significantly reduced from a burden perspective on your IT organization. Lastly, or not lastly, but one of the additional things that we wanted to talk about with cloud is that reduction in latency. As you start to navigate your relationships with more physician group practices that are reading from remote locations, cloud offers that ability to make sure that your cloud storage is where it needs to be, reducing latency and moving the study closer to a cloud server location where your readers are. And lastly, that increases the high availability of studies across your enterprise and across your reading network. Cloud also, could be a hybrid environment where you do store some packs and do some streaming rendering on-prem and move some of that leverage to the cloud. So it could be hybrid, or you can use that hybrid methodology as you transition to a full cloud implementation. And the other thing with cloud that you'll often hear from cloud vendors is just the reduction in costs. So with DICOM and PACS, as we start to see value or volume increases and the size of studies increases, cloud offers that ability to have almost near limitless scalability. So you're not having to buy 5-10 years worth of storage right up front and building out your own architecture. You can grow your architectural needs and storage needs over time as your demand increases. So if you're acquiring new facilities, it's very easy to scale your system accordingly. And the other thing with that is not just the storage, but the compute resources. So if you're spinning up and spinning down resources, this is very easy to do, just time-based if you need to spin down resources at night or however you need to manage them. And then lastly, as far as disaster recovery, and even maybe not listed here, but image lifecycle management, being able to reduce the cost of storage long-term and you have disaster recovery plans can be a little bit more easily and cost-effectively managed through a cloud vendor. And lastly, image rendering and artificial intelligence. These are definitely things that we can help support customers on. As you move to cloud, you can have separation and standardization of data performance across your enterprise, separating for machine learning services or research type settings for segregation of data as it deemed appropriate for research. So let's kind of look at some of the unique and complex relationships that are occurring in healthcare due to these growing demands around teleradiology and volume, and maybe what you're looking to do to adapt to the needs of your organization. So what we see with a lot of single entity health systems, whether this is just be your own community hospital or a multi-health system integrated delivery network, you often will see disparate locations, even if they're imaging clinics, and being able to orchestrate that work and move data appropriately across your enterprise can be more easily accessible through streaming clients. And with cloud technology, as we discussed, making sure that you can create secure access for your Nighthawk services or specialty care. We have spoken to lots of pediatric hospitals as well, where a lot of their high acuity patients might not be able to be read through their community health system partners. They don't have the specialty practice physicians that should be reading those, that are reading them on a daily basis. So they're working with other high level university or other children's hospitals to be able to offshore some of that volume as appropriate. The other thing is, if you're a growing regional center of excellence in your community, you may be trying to work with your community hospital partners that are smaller bed hospitals that are producing large image volume that just their staff cannot maintain, or they're looking to utilize you as a partner to provide reading services for them. And we do a lot of work and relationships to building those partner networks so that the movement of data is streamlined, to where if they have a PACS and you're trying to pull that data into your system, we do that in an intelligent way now with streaming and storage and cloud relationships, where we can ensure that the storage and management of that data is not as cumbersome and costly as it was in the past. And lastly, with a lot of the unique negotiation and networks that we're seeing, sometimes you see these multiple entity coordination where there's partnerships between imaging practices and group practices and health systems. And again, there's newer technology that we're working with customers on, and you can start to see this movement going in the market, where not having to move data through 14 different pipes. So oftentimes you may be requested by a group practice to just move everything to their location because they want to read it on their system. But as we're starting to create, we're seeing these types of networks grow, making sure that you're able to orchestrate movement of data across your system to theirs and back, and storage, streamline that in a way that you're able to move the data that needs to be moved without moving data that they don't need to have access to it. And in more modern streaming technology, we're working towards, if you're trying to provide those reading services, how do you do that in a way where you're not taking ownership of all that data? And how are you able to gain access to the data through a remote rendering node where the images can stay inside their network and never have to touch your network? So things to think about as you're starting to kind of navigate these new paradigms, is you're working with your clinical leadership to navigate how you're going to adapt and grow your partner relationships to be able to handle the volume of studies in light of the shortage of physicians that and that trend that seems to continue. So we just discussed some of the technologies, and I really wanted to kind of discuss this with you today so you can start to see how these can be force multipliers for you to start to actually think through, not providing a PACS to your health system, but actually providing continuity of care and how this works into providing an imaging health network, or how you're connecting the entire network of care that a patient traverses from an imaging basis, because it's not just about reading the exam, but as we discussed in the past, connecting that care across their current instance of care to their prior instances of care, and providing the appropriate data to your physician community to provide the best care for your patients. So I want to just thank you for your time today. We can now switch it over to our Q&A session, where hopefully I'll be able to answer any outstanding questions that you might have.
Thank you, Kyle. Such a great amount of information about the latest in imaging technology, and we definitely have some time for Q&A. So to remind everybody in attendance, thank you again for joining us. If you still have any questions, there's time to submit those through the Q&A function, and we'll get to as many questions as we can. So Kyle, let's get started here. Is there a generic infrastructure configuration that is used for cloud, or is each one custom?
Yeah, that's a really good question. I think I'm assuming this comes into leveraging cloud from the elasticity of it, and being able to maybe move into a multi-tenancy where multiple systems live inside singular cloud environments. There's not necessarily a standard out-of-the-box cloud configuration, but we do, from a imaging perspective, we want to make sure that all of healthcare data is secured in its own, tenant or single tenancy. So each of these single tenancies would kind of live in their own environment, which comes with some type of standard utilization of that imaging infrastructure. But as you probably know, you've seen one hospital, you've seen one hospital. So each one of these cloud systems will have to be managed individually to the site-specific needs.
And let's stick with cloud. What cloud? Questions here about what cloud vendors you support.
Yeah. So we get questions about this all the time of which cloud do you support, or and it's kind of a multifaceted question. So first and foremost, our enterprise imaging solutions can be implemented in multiple cloud vendors. So Azure, AWS, or maybe some others. But with our enterprise imaging cloud software as a service solution, we've standardized on AWS thus far. If you had, Azure credits or your Azure house that you wanted to implement this on, you could easily do that. You would just implement it in your instance, but then that would be a host managed solution. So you would be managing those systems, where with our enterprise imaging cloud software as a service solution, we take full ownership of the management of all of that. And a lot of sites are looking into doing that software as a service managed solution. Our partner with AWS has really worked with us to make sure that we've configured this in a way that medical imaging, as we discussed, we've alleviated a lot of the concerns around medical imaging in the cloud with our software vendor. And by doing so and utilizing our software as a service managed solution, we take a lot of the management off of sites so that they can refocus their staff to working more with the clinical team on clinical improvements and system utilization improvements. Most of this clinical staff or staff that helps as PACS administrators, system administrators, ClinApps, a lot of times they come from the clinical world and they're used to being able to really work hip to hip with the clinical staff. And oftentimes the system administration pulls them away from those duties. And by moving to our AWS partner software as a service, enterprise imaging cloud, we're able to manage a lot of that system maintenance and allow them to refocus their time to working with the clinical staff.
Well, on this theme of how vendors and systems and technologies work together, especially as health systems and hospitals become more complex. Let's switch over to a question on VPN. The questions, the VPN we currently use slows down our current system. How would a VPN affect streaming?
Yeah, kind of like I mentioned earlier, VPNs, Citrix, remote sessions, things of this nature oftentimes have intrinsic system limitations. And with newer, like our on-prem solution or cloud solutions, if your organization has taken a stance that VPN is a mandate, we can work through that VPN and still have, we've shown some pretty strong system performance capabilities with our stream client and even our full desktop client. But with a lot of the newer technologies, I just implore you to talk to your vendor, or if you're looking into how these newer technologies may alleviate some of the prior concerns where those concerns were leaning you into using VPN and other solutions. It may be just to think through, is the cloud and these other newer modern technologies helping to alleviate the necessity for VPN? Because with pixel streaming, you're not moving full data sets across networks. It's really, you're just moving the pixel data. So things like that, you want to kind of think through, do some of these newer technologies help alleviate the concerns where you may be able to not have to put everything through your VPN anymore?
Okay, very good. And then when we think about rural locations with very limited connectivity options, can pixel streaming handle low bandwidth with high latency scenarios, such as like 5 megabit download with greater than 50 millisecond latency at times? Or is
Uh,
it
y- yeah, no, that's a good question. I think we discussed a little bit about what we recommend. So for our customers, we seek high performance at 60 milliseconds latency, 10 megasecond or megabit per second bandwidth. So even in like rural locations, we've had customers discuss with us Starlink and very obscure type utilizations. We can test this and make sure that it's working for your facility. But with most systems, it's your miles may vary. Not every single one of these clients is built on the same technology, and not every single system is going to be able to deliver the same level of capabilities. So it is something that you want to kind of think through where your systems are going to be. If they're on-prem, how far away is your furthest reader and what the latency will be for them. If you're moving to cloud, where you may want to situate your cloud instances to create the best reading environment for all readers as it makes sense for you, as well as, when you're looking at vendors, what are their bandwidth and latency requirements. So like I said, 10 megabits per second, fairly standard. It can operate maybe a little bit lower than that, but we want to make sure that even at the highest utilization of the system, we're providing the same standard of care tech quality. So for us, that 510 megabits per second, 60 millisecond latency are all within the realm of possibility.
very good? Well, on that note, while we just linger here to see if there are any final questions coming in from the audience, it makes me wonder, maybe you have an answer for this. As you just talked about some of the little challenges that companies may see or think are in place to adopting some of the technologies you discussed here in your presentation. As you talk to your clients or about this, or just hospitals and health systems curious, maybe looking in the direction of these technologies, do any hurdles stand out to you as far as, are they ready for this? And you just kind of talked about the latency and download speed, as somebody might think, oh, this puts us out, we can't do it. And you've just alleviated that. You allayed that fear. Are there any other hurdles that stick out where, okay, a company might not be ready? Or is it infrastructure? Is there something that stands out that, as you talk to these clients and people interested in this technology, that they may need to address to be ready for the technology you discussed today?
I maybe I'll say it too many times, but if you've seen one hospital, you've seen one hospital. And health systems are all, struggling with some of the same, global or, macro level issues, but every health system is maybe at a different intersection of what they're trying to solve today. And solving the biggest problems of today are usually the biggest focuses and where the budget dollars go. One thing that I would say is that from a medical imaging perspective, you see these types of shifts, whether it was in the late 90s, early 2000s, where we had struggles with physician shortages then. And the PACS environment allowed us to start to digitize medical imaging. And just that digitization and the ability to disperse film more prevalently helped to make physicians more efficient. This is continuing, and you have to think through what's your budget for the next few years so that you can get ahead of the curve and move to the technologies that are going to put you in the best place for the future. So while it may not be today's priority, it's definitely something you need to talk to your vendor and talk to, us or whomever your trusted advisors are on what steps are you taking and what's your plan to move to the next technology infrastructures of cloud, AI, et cetera, streaming, that are going to revolutionize how you make your physicians more efficient, considering the shortages that we discussed.
Very good. Well, thank you, Kyle, for hanging in for some questions, and thank you to you and the AGFA crew for helping us bring this webinar today. Thank you to everyone who attended. As a reminder, this webinar will be available on demand. In just a short while, you will receive an email notifying you of such. and you can access that link and catch the on-demand video. So thanks again, Kyle, and thanks again, AGFA, and thanks everyone for attending. This concludes today's webinar.